Dear listeners, before we begin today's episode, a quick announcement. Tomorrow, we'll publish a special episode of an Indian Express podcast in collaboration with Parul University, where I, Flora Swai, will be in conversation with Dr. Kunjal Sinha, who's the Director of Center for Continuing Education and Online Learning at Parul University. And we'll discuss the dynamic landscape of online MBA education. So don't forget to tune in tomorrow at 11 a.m. Now on with the show.
Hi, I'm Shashank Bhargava and you're listening to Three Things, the Indian Express news show. For a while now, the Kashmir Valley has been dealing with the problem of militancy, an ongoing political vacuum, and the lack of job opportunities. But now a different kind of problem has been wreaking havoc in the region. This is the valley's devastating pandemic of drug addiction that has tightly clenched its grip on the youth, overburdened its public health systems, filled up detention centers, and has inflicted families with insurmountable tragedies. This is what a recent Indian Express investigation has found out. For over 2 months, the paper visited several addiction treatment centers across the region and spoke to the affected families, doctors, bureaucrats, and police officers to understand the unprecedented scale of the problem. And today, we will be dedicating our entire episode to talk about this issue. Joining us now is Naveed Iqbal, who led this investigation for the paper. Naveed, could you begin by giving a sense to our listeners about just how big the drug problem is in the Kashmir Valley?
Initially, when we decided to investigate this issue, one of the things that we were noticing more and more was that we were getting more information about drug seizures, arrests of drug peddlers, about narco-terror and the networks. Then we started noticing an increase in information about social crime. At some point, there were so many stabbings that right now it is illegal to carry a sharp weapon or a sharp knife in Srinagar. There's an official order by the Deputy Commissioner banning the use of sharp knives. And if you have one, you have to have a good reason for it. Then we started noticing an increase in patients at the Srinagar's main drug de-addiction center at the SMHS hospital. So doctors said that while they were seeing about 5 to 10 patients a few years ago, they're now seeing patients to the tune of 30,000, 40,000. That was also a main indicator in establishing this problem. Also, over the last 18 months, the J&K government has increased its de-addiction capabilities from like 1 de-addiction center in Srinagar to 8 in the 10 districts of Kashmir. And 2 more are on their way to get approval. They also want inpatient facilities in all these centers, not just an OPD where patients can come and go and rely on drug replacement therapy and counseling among other options. What has also increased is that there are conversations about this in drawing rooms in people's houses. There are conversations in political parties about this. People who go on walks have started noticing syringes lying by the streets, or some areas started developing a reputation for, like, in that area, a certain kind of people hang out and trying to keep their wards or the children away from it, or in certain schools or colleges. All of these metrics drew us to investigating this issue.
And what kind of metrics indicate that this problem is in fact on the rise right now?
So one of the things that mainly help us establish the increasing drug abuse problem in Kashmir is the patient intake, where doctors have said that from 1,000 patients, maybe they are now seeing 20, 30, 40,000 patients. Number of FIRs registered against drug peddling in NDPS have gone up from, say, about 1,100 to 1,800 this past year. Number of arrests have gone up to over 2,700 in the last year. Number of seizure of heroin has gone from less than 100 kgs to over 250 kgs last year. Likewise with other opioid derivatives and charas, etc. 915 kgs of charas was seized last year. So these are things that all indicate an increasing problem, a rising problem. And also the fact that the government is enhancing its de-addiction facilities across J&K. That also is a recognition of the growing problem.
And since when would you say this current drug problem began in Kashmir?
So what I found out during this investigation is that during around the year 2000, what Kashmir was largely dealing with was a substance abuse problem in terms of pharmaceuticals, painkillers such as Tapendol and Tramadol, etc. And people were using prescription drugs initially, and then patients were developing a dependency on it. But after around 2010, there has been a switch to hard drugs or opioids. Here also the concern was the doctor said while, a painkiller costs between rupees 450 to 500, opioids cost like a gram of heroin now costs about 3,000 to 4,000 rupees. But what they're saying is that the availability of the drug across Kashmir has increased. And when in 2000, say 15, 16, they would see 2 to 3 patients. In 2019, this increased to 20,000 patients. In 2020, it increased to 30,000. And now we are in the 40,000 range of patients in one center, in the Srinagar Drug De-Addiction Center.
Right, and which is actually the largest de-addiction center in the valley. And the investigation shows that it saw a little over 41,000 patients in the year ending March 2023, which essentially comes down to one patient walking into the center every 12 minutes, which is a significant number. But tell us, when it comes to the availability of drugs, which one is the most prevalent in the region?
So currently we have only a 1-year survey. The other surveys are still in the works. So that survey points us in the direction of heroin. It says the largest among the drug users in Kashmir, 75% are heroin users. And many of these are also presenting to the hospital with cases of hepatitis B and C as well as HIV. So one of the doctors described the drug situation in J&K as grim and alarming.
And Naveed, what is the general profile of people who are currently dealing with this drug problem, who are now dependent on these hard drugs?
Largely, drug use is rampant among young males, and the age group is 15 to 30. And amongst these, 25% as per, the survey by Imhance is only 8% are illiterate, 25% are unemployed, 15% are graduate, and about 33% are class 10 pass. So that's largely the profile of the patients here. But doctors say that these are survey figures, but they see patients anywhere between 15 to 60. And women, men, people from all walks of life, people from all economic backgrounds.
Yeah, in fact, in your report, you mentioned that 90% of all users are in fact young men with the mean age of 28. What stands out to you the most about this?
Yeah, so from all the conversations that we've had in the last 2 months, one of the things that has been most concerning, political parties are talking about it, people are talking about it in their drawing rooms, officials are talking about it, doctors are concerned about it, is that if J&K has lost, say, 2 generations to the problem of militancy, are you willing to lose a third to the drug issue, to the drug problem? What's also concerning here is that the DGP of the state police who we spoke to said that societally, this is a bigger problem than militancy right now that the people are dealing with.
And Naveed, when you spoke to experts, doctors and psychiatrists, what did they tell you about why these young men are getting into this problem?
So experts have pointed to a few reasons for this. One is, personal crisis that anybody might be going through. Then there's financial stress, lack of adequate job opportunities, life in a conflict zone and its uncertainties. And also J&K being a largely Muslim majority population, alcoholism is looked down upon. And so, smoking once in a while or smoking weed or other opioids is considered like an okay by that measure. It doesn't necessarily have societal approval, but it's not looked down upon as much as alcoholism is. So this is something that was not considered a problem till about the year 2000.
And did COVID-19 have a role to play in this? Did the pandemic at all make it worse?
Yeah, so some experts have pointed to it. They've said that around COVID-19, because there was absolutely schools were shut and colleges were shut, people had a lot of time on their hands and they didn't have enough recreational opportunities. So because of that and the stress of living, having nothing to do, that drove some people toward addiction as well as peddling. Because there wasn't enough opportunities of livelihood opportunities, this became lucrative because people earned a lot more in a much shorter time. That also points to an increased availability of drugs in the system.
Yeah, and availability is a big part of it, right? Especially when we're talking about the reasons why young men are becoming addicted. And the fact is that there are a lot of drugs, especially heroin, readily available in the region. And geographically, of course, Kashmir borders Pakistan, from where we know that drugs are known to enter India. So talk about how the region's location affects this crisis.
So one of the doctors who we spoke to, the head of the de-addiction center in Kashmir, Srinagar, said that J&K sits geographically is located near the Golden Crescent, and that's why there is a easy availability of illicit opium, which is the Iran, Afghanistan, Pakistan belt. So police have also told us that heroin is largely coming to Kashmir through Pakistan. This has increased over the last 2 years. Drugs are coming in through by way of either personal couriers or through drones. So a lot of that activity has been noticed both on the LOC in Kashmir and on the IB in Jammu.
Yeah, and when you spoke to the Director General of Police, he told you that this also poses a new problem of narco-terrorism. Could you speak to those concerns and the implications of it?
So the DGP of the J&K police, who we spoke to at length about this problem, said that narco terror has become a more immediate concern in the last year or so, mainly because there's a ceasefire agreement on the LOC. And so weapons that were earlier coming with people are now coming through drones. But what they also started seeing increasingly was drones bringing weapons as well as drugs together. So that's what brought the narco terror angle to it. So what he's also saying is that drug that comes into Kashmir does not get entirely used here. It travels to Punjab and other parts of the country by road, and the money that comes in travels back to Pakistan. What is important here is that post-2019, a lot of the easier terror funding channels, as they described, have dried up. So this has become a lucrative or most attractive way of funding terror by bringing in drugs. And as the DGP said, that everyone benefits in this chain except the end user, the victim.
Right, and the DGP also mentioned that there are structures in place that support this incoming supply of drugs. Talk about what he said in that regard.
So when we discussed drug networks across J&K and how these were eventually coming into the system, he talked about one, involvement of villages beyond the fence at the LOC and many villages close to the border in Jammu like Rajouri, Poonch. So he said that a lot of these areas have divided families. And also because it's lucrative, it's easy to tell someone to transport a packet and, get a large amount of money for it. So while the source may be Afghanistan or Pakistan, it's traveling within J&K through person-to-person couriers. And a large part of it is then going to Punjab and some drug is coming from Punjab and money as well from other parts of the country. So that's mainly the structure that he explained. He said it's traveling in public transport, it's traveling in trucks. So that's how it's going around the valley and beyond.
And Naveed, to understand this problem better, you visited a number of addiction treatment facilities in the region. Talk about the kind of support they provide and what you witnessed there.
So initially there was one main drug de-addiction center, which was in Srinagar at the SMHS hospital. Over the last 18 months, 8 more have come up in different districts of Kashmir. What these centers do is identify the patient, get a history, also identify what kind of therapy they need. There are experts that deal only with de-addiction that are there. And largely these de-addiction centers are attached to the psychiatry departments of these hospitals. A lot of these patients sometimes come alone and sometimes they come with their families. But again, there is varying, there's no set pattern. Some families will come and, would be cursing the child that they've brought with them and saying he's a good child otherwise, but look what he's doing to himself. Others are threatening and saying, I'm going to report him to the police, if he doesn't correct his ways. So there's differences in how these families treat the patient, but a lot of the 20 to 30 age group largely comes to the centers alone because of stigma of drug abuse.
Yeah, and this stigma is a big part of this problem. This is the reason why a lot of people are hesitant to talk about it and seek proper help. So tell us a bit more about this aspect and how this contributes to the overall issue.
Right. So one of the things that doctors do when the patient comes in is to make him comfortable and to be able to tell his story. If he's more comfortable telling his story, say without his family around, they allow him to do that. And the general attitude is to give him an ear and let him know that someone's willing to listen to him, as opposed to start calling him a patient and calling him an addict. In our interview with the LG of the state, Manoj Sinha, he said that what we don't want is to deal with the victim as a criminal. The emphasis of the system should be to provide support to him and to work for his rehabilitation. In many of the district centers that we visited, like in Kupwara or in Anantnag, what we realized was that the doctor said a lot of the patients don't come to the immediate center in their village or their district. They prefer going as far as possible so that their people in the village or the district don't find out that he's seeking treatment for addiction. We even saw a patient from Ladakh in the Srinagar de-addiction center. So what patients are trying to do is bring in more and more distance from where their families live so that they can deal with the problem on their own if possible.
And we earlier talked about how some of these de-addiction centers are seeing a huge number of patients. In Srinagar, 1 in every 12 minutes. How are they being able to handle this kind of load?
So OPD doctors that we spoke to said, like in Srinagar, they are seeing sometimes 250 patients in a day, sometimes, more. So there's a big patient load. So ATFs are OPD-based services. De-addiction centers are IPD. They also, can keep patients overnight, etc. So what J&K government is pushing to do is they are trying to get inpatient facilities in as many of their addiction treatment facilities, the smaller ATFs, as possible. But that will take some infrastructure push as well. But I'm told by the secretary and those familiar with the problem that they are working toward making more and more of these centers IPD-based.
Yeah, IPD, of course, meaning inpatient departments where people can be admitted. But one imagines that the problem must also take a toll on the families of those suffering from this problem. You mentioned how some parents, for example, can't help feeling frustrated with their children. You spoke to some of these families. What are the kind of things they told you?
In some cases, like I said, there's a lot of family support. Like we met this one driver's mother who said, I'm going to bring him as many times as it takes. And I know there's a good kid in there somewhere, so I want him to get better. In other cases, I met the brother of a patient. The patient was one of 5 friends. 4 friends had died. And then the family found out and brought the 5th boy, the patient, to the drug de-addiction center. And he said, I'm just going to hand him over to the police. Like, this is my last resort. I'm going to try and bring him to the hospital today. But after this, I will just hand him over to the police. There are patients who report excessive fights at home or like selling things or like utensils and, jewelry from home that they sell. And then the family finds out and they bring them to a drug de-addiction center. What is good is that there is a certain amount of faith in the treatment, in the facilities and the doctors. So with that in mind, patients, what doctors say is that it's a good thing that more and more patients are at least coming to the de-addiction centers. So with more awareness, with more growing concern, at least patients are coming to seek treatment.
Okay, Naveed, one imagines there are 2 major areas when it comes to tackling this problem. One, of course, is not letting drugs come in from across the border, and the other is helping people already suffering from this issue. So first, talk about what the law enforcement is doing right now to stop the narco-terrorism side of things.
There are many aspects to dealing with the drug problem. One is increased attack by the police on narco-terror networks. So police have said that not just us and our networks, general public is welcome to send us information that we can act upon, and we are going after anyone that we know is involved in peddling drugs. This could be small, this could be big, and they are welcoming any information that they can get. The other aspect is that legally they're adopting stronger laws to deal with those involved in drug peddling. So what the police have told us is that they are using financial investigations also to clamp down on these networks, something called Prevention of Illicit Traffic of Narcotic Drugs and Psychotropic Substances Act, the PIT NDPS. Also, we've seen over the last year, J&K police also using the Public Safety Act, which is a more stringent law in dealing with narco-terror and drug peddling in the valley. Then there is what they are also developing an SOP for, as the DGP told us in his interview, is seizing properties of drug peddlers. So what they're saying is if you have this is a property or this value is a proceed of narco-terror or such a network, they will seize those properties also. So they are acting stronger and faster. But what they're saying is more important is identification of victims. While these individuals are going to hospitals seeking treatments, police also believe that identification of these victims is enough so that they can try and attack the networks behind these drugs being circulated in the system.
And in this context, what would you say is the biggest challenge that the authorities face?
So one of the things that police have told us is that the challenge is that everyone benefits in this system, barring the victim. So to pull people away from such a lucrative business is what is challenging. And the fact that they say that the drugs are coming from Afghanistan, but the conduit is Pakistan. So the intent of the neighboring country is to keep pumping drugs into the system. So when they are saying that when the intent is to keep fueling this issue, this is unlikely to go away just by, addressing it within the valley.
And now the second part of the problem is how to effectively help people who are currently dealing with a drug addiction. You mentioned more de-addiction centers being opened and plans for more inpatient departments. Is there anything else that the authorities are planning?
I think a lot of the focus is on increasing awareness around the drug problem. Every conversation was shrouded in, the cover of militancy around Kashmir for a very long time. This is something that is now gaining significance, and this is something that is now in conversation. So the awareness is something that hospitals and doctors are at their end trying to increase, but this will also take an all-out effort.
And Naveed, as someone who has been investigating the story for over 2 months now, what stands out to you the most about it?
I think one is that many of the patients that I met were willing to do something about it. They came to the de-addiction centers wanting to get better, wanting to hide this from their families because they are aware that this is bad and this will also hurt their families. So a great part of covering this was meeting the patients who said that they are willing to change and willing to adopt a better lifestyle. The other part is what mainly concerns anyone dealing with this issue is the age group of the individuals. These are young people. This 15 to 30 age group is your productive age group. So what concerns authorities as well as law enforcement agencies is that they cannot lose this generation to violence or to the drug problem. So that's one of the major concerns, I think. The age group is a major concern.
You were listening to 3 Things by The Indian Express. Today's show was written and produced by me, Shashank Bhargava, and was edited and mixed by Suresh Pawar. If you like the show, then do subscribe to us wherever you get your podcasts. You can also recommend the show to someone you think will like it, share it with a friend or someone in your family. It's the best way for people to get to know about us. You can tweet us at Express Podcasts and write to us at podcasts@indianexpress.com.